All right. Well, we'll start this non-politically charged discussion about vaccines. Here we go. All right. Thank you. That's a great little addition. Ben Franklin. All right. An ounce of prevention is worth a pound of cure. No truer words have been ever spoken. So he lost a 4-year-old child to smallpox and regretted there was an inoculation available at that time. But in his time as well as our time, there was skepticism. And so he was not inoculated, and his son subsequently passed in 1736. So just sort of speaking to the long-term apprehension that people have had against injecting something into their body to stimulate a theoretical response or a real response to a full-blown illness. So vaccines are one of the most effective tools for preventing serious illness, disability, and death. They work by training your immune system to recognize and fight harmful germs before you encounter the real disease. So vaccines and sanitation are the reason we are living to the levels of age that we are now. It's not nutraceuticals, it's not supplements, it's not some longevity hack, cold showers. It's vaccines and sanitation, and obviously a good diet. But nonetheless, vaccines remain very important. But with COVID, as we all know, there has been some pushback, and it has created more apprehension among people about what information do I trust, where do I get good, solid information. But vaccines have been around for a very long time, and MMR and Tdap and all those vaccines have been studied for decades, and the adverse effects have been followed by independent agencies. And so I think that we need to remain vigilant and make sure that we are making informed decisions about what we put into our body. But I do believe that science does still exist, and that the vaccines are indeed safe. All right, so let's talk about just basics of the immune system. We have two major pieces of our immune system. The innate immunity, meaning just sort of the mechanical stuff that we have. Our skin, our mucous membranes, our saliva has acid in it that breaks down viruses and bacteria. We have the fever and inflammation reaction that is just our response to try to mitigate an infection. And sometimes that's enough to overcome it, but sometimes it is not. And that's why sometimes we maybe don't mitigate fever, because that is part of the response to kill in most instances, a bacteria that has entered the system. And then we have adaptive immunity, and that's when we start to talk about vaccines or exposure to, say, chickenpox. You get exposed, your body develops cells that then remembers that exposure and prevents infection or severe infection in the future. That is the adaptive immunity, the cellular response. And that is constantly changing given our environmental exposures and whether we're exposed to the illness itself or the vaccine for the illness. And that is a very specific response. We develop responses specific to a virus or a bacteria, whereas the other stuff is just kind of a general barrier. Okay, so what do vaccines do? Essentially, they are a fire drill. They either introduce a attenuated virus or bacteria or pieces of proteins of that virus or bacteria that then stimulate our immune system to recognize it as foreign, have somewhat of an immune response, and then remember and then if we ever are exposed to it, our body remembers that and is able to get on top of it before it overwhelms our system. And so how that does it is by producing antibodies and then creating memory cells. And that is, I thought that was the next slide. There are two types of cells, memory B cells and killer T cells. I should say killer T cells. And that's what our vaccines are doing. They're stimulating the creation of these cells that then circulate in small numbers all the time. And then once a foreign invader that these guys remember is recognized, they then stimulate the creation of more of them so that they can basically pounce on top of it before it spreads and gives us sepsis or a major illness. And so that is what we're trying to stimulate by getting vaccines. Now, what are the types of vaccines? The mRNA vaccine I put up top because that's the one that's getting the most press lately. And those were the ones that during COVID we're bringing up the major concerns. So mRNA vaccines, basically every cell is encompassed in, say, a bubble, and then you've got a nucleus. Within that nucleus is where the DNA is. And that DNA creates messenger RNA that then goes outside the nucleus and in the cytoplasm creates all sorts of different proteins. Some viruses hijack that factory, basically getting into the cells and using that process to create their own DNA and RNA, and that's how they proliferate. So the mRNA vaccines for COVID do not enter the nucleus of the cell. They do not alter our DNA. They simply get inside the cell and use the mechanisms that are already there to create proteins that then are, expressed on the outside of the cell to alert it that there is a foreign invader, and when you recognize it, you need to have an immune response. It is what we call attenuated, so the response is not like a full-blown infection. It's just a mild, that's why you feel after a flu vaccine or possibly after a COVID vaccine a little ill, down on the weather. After most vaccines you feel a little ill because you're having a mild immune response. That's what you want. What you don't want is the full illness, and so by getting that light immune response, your body's keyed up, so next time maybe you don't get any response at all, or maybe you get a similar light response from a real COVID infection or flu infection because your body's already ready for it, right? It doesn't have to start from behind the eight ball, so to speak. So, so the big debate was, are these mRNA vaccines altering our DNA? And the answer is no. And the M does not stand for microchip. There are no microchips in these vaccines. I still hear that. So no microchips in these vaccines. Messenger RNA, that's what the M stands for. So, and then there's the inactivated vaccines, which is mostly what we are getting right now. Those are, again, either full dead shells of the virus or bacteria, or they are pieces of that virus or bacteria. And then there are live attenuated vaccines. We have the flu mist, which we give to little kids. That's a live vaccine. None of us get a live flu vaccine. We all get attenuated dead vaccines for flu. The measles and chickenpox vaccines are also live vaccines, and that's why people with immunosuppression or major illnesses need to beware of being around people who have recently had the vaccine or have those viruses because they shed. Only people who have live attenuated vaccines shed virus. Not a lot, but they do indeed shed some virus. So we, at our age, we are not having exposure personally to live attenuated vaccines. Everything that we get is either a dead virus or bacteria or a protein of that dead virus or bacteria. And then that's exactly what these are. The subunit or conjugate vaccines is basically throwing that dead virus or bacteria in a blender and putting it into our body. It's dead. There's no reaction. There's no illness that is created from it, but that protein allows our body to recognize it as foreign. Does that all make sense? We're just kind of doing a fire drill. And then the toxoid vaccines, where you're injecting a mild or a very small amount of the toxoid of, say, tetanus or diphtheria, again, to stimulate a mild reaction so that if you're ever exposed to the real thing, you're already ready for it. Okay? So those are the types of vaccines. Any questions on those? Okay, so this is from the AMA. This is kind of a neat and interesting survey recently. Over the past 2 or 3 years, how has patients' awareness of vaccine safety changed in your practice? And there's a significant majority, these are physicians answering these questions, 71.43% say their patients are more skeptical. I would agree with that. I think there's a lot more skepticism with vaccines and trust of our government agencies at this time. And some of that is legitimate. Some of that is indeed legitimate. But nonetheless, that's why you come here and we have an informed conversation so that you can make an informed decision about what you want to do based on facts, not on social media, which is unfortunately where a good majority of people are getting their information. And there's just no, they can say anything. I mean, and you don't even know if it's real anymore. I mean, the AI stuff is absolutely insane. All the videos of people getting eaten by hippos and it's crazy. It's crazy. So you can't, the stuff on social media, it's not regulated. You cannot take it for gospel. It's certainly a place to maybe develop some questions, but it's not the place to be getting your definitive information. Do your patients raise concerns about vaccine safety during discussions about immunizations? Absolutely, majority do. That resonates with me as well. And do you think it is helpful for medical associations, i.e. the American Academy of Family Practice or Internal Medicine, to issue guidance separate from government sources? And most of you, or most people, said yes. That is concerning because our organizations obviously work hand in hand with those major health organizations. And so trying to, and we saw some of this in COVID, and it didn't work out all that well. And so I don't know if that is a real solution, but it speaks to the distrust that many people have. And hopefully the trust that you all have in your personal physician. And that's what we hope to maintain. Okay. So vaccine myths versus evidence. Vaccines cause autism. That's a popular one. That has been studied at length. It has been proven to be not the case. The guy that published that original study has retracted the paper, but that still definitely persists in the community. RFK is still pushing that theory. I don't agree with that. Too many too soon overloads the immune system. Infants encounter far more antigens daily, and current schedules are extensively safety tested. This is an interesting one. And I'm open to working with parents on spreading those vaccines out, because among adults, I do find that I think you should probably get your flu vaccine, wait a few days, get your COVID vaccine, wait a few days, because if you have other comorbidities, pulmonary or cardiac issues, these stress the system. That's what they're designed to do. They're designed to stress the system, do a stress test, get you prepared. And so if you're slamming the system with all these different antigens that it needs to react to, people with major comorbidities do experience enough stress to sometimes put them in the hospital for either a heart failure exacerbation or pulmonary illness exacerbation of some sort. And so when it comes to kids, I think this can be debated. I don't have a definitive answer on this. There are a number of different schedules that physicians have come up with to spread those out. And if parents are wanting to do that, I would much rather they do that and get vaccinated versus, making sure that we stay on the CDC mandated schedule, which I'm also, that's what my kids got. That's what I got. And, I think there are unfortunate cases. We are all different individuals, and we can have adverse effects from different things. But that childhood vaccination schedule has been studied extensively, and it has been shown to be, for the most part, very much evidence-based. But again, I think there is some theoretical legitimacy to overloading the system, especially if you have underlying issues that already are stressing the system. Does that make sense? Okay, mRNA vaccines change your DNA. We've already talked about that. Vaccinated people shed the vaccine. Only those who get live vaccines. Again, none of us. Kids are getting those, but not us. Vaccines cause infertility or miscarriage. That has been not shown to be the case. It's difficult to kind of tease that out when you've got a vaccine, but you've got all these other factors that could be contributing. And so when you try to tease those out, it has not been shown to be consistently the case. So that has been disproven. Toxic ingredients, aluminum and mercury. The aluminum, the heavy metals, there is some heavy metals in there. We get more exposure to heavy metals in our daily life than what is in our exposure in these vaccines. And the thimerosal, which there's still question about how much that was adversely affecting, has been removed. And so there was some correlation of the autism with that. That was removed, but that has also been disproven, but we no longer put that in vaccines for preservative. COVID vaccine, myocarditis risk is worse than infection. This was strongly debated during the COVID epidemic or pandemic, and it was shown that actually COVID infection caused more myocarditis than the vaccination. But this is exactly what the vaccine was designed to do, was stress the system, and that myocarditis for people who are a little bit immunosuppressed did develop some myocarditis from that vaccination. Natural immunity is better. That's, I think in the case of chickenpox, that's certainly been shown not to be the case, because you are then at risk for shingles. Whereas if you get the varicella zoster vaccine and you never get chickenpox, you are at much lower risk, if not no risk, at developing shingles. So certainly, to a certain extent, they did find that if you were infected with COVID and you got the vaccines, your immune response was more robust than those who just got the vaccine or just had the natural immunity. But being exposed naturally certainly does give you the exact memory B and killer T cells that you need. So if you develop natural immunity that is indeed robust, it is a high price to pay sometimes, depending on what else you got going on. And then the vaccine adverse event reporting system, this has been around for many, many decades. It is an independent agency. It collects all adverse events. And so if you go in there, there are myriad adverse events, and it looks like vaccines are not safe. But they're very mild. It's from arm pain, low-grade fever, every adverse event is in there. And so the major adverse events they pull out, and those are the public is alerted of those. And so although there are adverse events, I think we can more classify them as side effects versus major health risks, right? It's just, it is the small price that we have to pay in order to establish that immunity. Okay, so what's unique about places like us? Rural communities face unique health challenges. I kind of take this personally when I read this stuff. But nonetheless, I was in a meeting this morning and we were looking at this map of Nebraska and the birthing hospitals. And in central Nebraska, there is a huge obstetric desert where people have absolutely zero obstetric and gynecologic care for hundreds of miles. And so that is what they're speaking to here, is just access. We are very unique here, that we have an extremely robust hospital system with access to specialists, with appointments that are available, and we're open 6 days a week. This is incredibly unique in rural America. And so for most rural communities, that then creates a much higher risk, because if you don't have access, or if you have to travel 3 hours to get access, you're probably going to wait a little bit. And that waiting may then exacerbate or worsen your illness. And so that's where they're coming from with that. Vaccines can help prevent those things, i.e. pneumonia vaccine. Misinformation and mistrust are real barriers. Obviously, we've talked about that ad nauseum. And I like this statement: we are here to have open and respectful conversation. There's no pressure to get vaccines. I'm not pushing vaccines on anybody, but I think we all need to be informed and make informed decisions about how we want to navigate this. Okay, so let's get down to brass tacks. What are we talking about for vaccines today? The annual flu vaccine. I just got mine. We'll go into detail about each of these, but these are the major ones: flu, pneumonia, shingles, tetanus, diphtheria, pertussis, and then COVID and RSV. So let's go into those in detail. This is just a priority catch-up schedule. I'm not really going to go through that, but if you don't have vaccines and you want to catch up, there are specific recommendations for how to catch up, and this is just an example of that. Okay, so influenza. Interestingly, in Washington State, the first case of H5N5, which is an avian flu variant, has been found for the first time in a human. It's probably happening in China, but we don't have the data systems over there to track. But this is a bird flu that has now jumped to humans. And if you remember H1N1 several years ago, mostly up in Canada, but it did affect the United States. The problem with that is when you have a new zoonotic virus variant that comes into the human circulation, None of us have any exposure to that. That is an animal or a bird, an avian variant that none of us have exposure to. And so we have no way to have any attenuation to that. And so you get a severe illness. So this guy they think, got it from his birds. He was raising ducks and chickens and all sorts of other things. And of course, Washington State, Vancouver area is a big area for virus transmission from China in the eastern area of the world. So that's just kind of an aside. The thing about flu is it changes every year, and so that's why we have to get a vaccine every year. Some vaccines you only have to get once in your life because that's what it is, and it never changes. Flu changes all the time. So we look in the southern hemisphere during their flu season to kind of guess what's going to come up here. We base our vaccine on that. Sometimes we get it, and sometimes we don't. Sometimes it mutates so fast that it's only 20 or 30% effective. This year's vaccine is estimated to be 50 or 60% effective, so pretty good. Nonetheless, any exposure to a flu vaccine is going to attenuate exposure to any of the other human flu vaccines. Maybe not as much as getting the exact virus, but just like the COVID vaccine, the COVID protein is changing all the time. An old COVID vaccine is still protecting you somewhat, even though there's some mutation. Not as much as a new vaccine would that's specific to that mutation, but you still have some protection. But over time, that protection wanes, which is why we get it every year. They are suggesting now even more strongly that we get the flu vaccine, because if this H5N5 really starts to hit the fan and spread, this vaccine will give us at least some attenuation of that. Not a tremendous amount, but some. Certainly more than someone who has had no flu vaccine. All right, so what types of flu vaccines are available? We talked a little bit about this. The nasal flu vaccine that the kids get, that is a live vaccine. We do not have that here. We have the attenuated vaccine of the regular dose and the high dose. The high dose is recommended for people age 65 and older. They tried to give that to me this morning. But I got the regular dose still. I got about 12 years left. So anyway, as an aside, those vaccines are just protein fragments of the H1 of the flu shell, and again, that just kind of keys our immune system up to recognize when we see the flu, which most of us will this year see the flu, and we will have more mild illness if we have been vaccinated. Let's see. We talked about the matching strains. What other notes do I have here on flu? That's about it. Do you guys have any questions on flu vaccines specifically? No? Okay. Pneumonia. All right, the pneumococcal vaccine. This one's kind of a little bit confusing because this is indeed a vaccine for a bacteria that causes pneumonia, specifically strep pneumoniae. It does not prevent all causes of pneumonia. There are other bacterial and viral causes of pneumonia, RSV, H. flu, Staph aureus, mycoplasma, that this vaccine does not prevent. So even though you get this vaccine, you will be prevented from getting strep pneumonia, pneumonia, sinusitis, meningitis, but not pneumonia in general. You can still get a lung infection called pneumonia, even though you have had the pneumonia vaccine, okay? This strep pneumonia has many different strains, kind of like the human papillomavirus that we give to kids, the HPV vaccine. And so that's why there's different, one, the PCV20, that's got 20 different strains, and then there's the 15 and the 23. These are changing. The current recommendations are up there. You guys would have to look and see what you got, but in any case, this is a vaccine that protects against several different strains. Those strains do mutate, and these will, over the years, change, and the recommendations and vaccines will change. Not as much as flu, but still does indeed change. That's all I've got on that. Any questions on pneumonia vaccine? Okay, shingles. How many of you have had the shingles vaccine? How many of you have had both shingles vaccines, the Zostavax and the Shingrix? Okay. So the Zostavax, the older one, was a live vaccine. So people with immunocompromised states couldn't get it because it was indeed live. We have moved to Shingrix, which is, again, just an inactivated version of that varicella zoster. And it's got a chemical in it which stimulates your immune system so you get a more robust response. This vaccine has been shown to last much longer than the Zostavax. It has been shown to attenuate or prevent the infection or flare-up of shingles much more effective than the Zostavax, but the side effects are much worse, and it's a series of 2. And it's generally that second one that really hits you. The first one you feel kind of bad, like a flu vaccine. The second one, people generally have to stay home a day or 2 because it is quite a robust response. Did anybody experience that with the Zostavax? Was it pretty? I'm sorry, the Shingrix. Was it pretty rough or no? No? Okay, good. So anyway, the Shingrix is indeed recommended for everybody over the age of 50. The varicella zoster virus, if you get it, the reason we get shingles is because that virus in particular can hide within our nervous system and has some mechanisms by which it prevents our system from seeing it and reacting against it. And so that is why when you get chickenpox, it will come back later when you're stressed or ill as shingles in some way, shape, or form in your body. It often presents in what's called the dermatome. So coming out of our spine, we have these bands of innervation. And you can see that, you can look at that online. But when you get shingles, you will generally get it in a very well demarcated band on one side or the other. And if it's in the face, it's much more serious. But that's why it presents like that, because it's just kind of climbing up and down our spinal column, and then it exits in one of those exit canals, and that is the area of innervation that is affected. Okay, Tdap. Most of us, if not all of us, have had this. We don't see, I don't think there's been a case of diphtheria in the United States in quite some time. Pertussis, however, is a big deal, and it's increasing in the United States and in this area in general. It is more of a problem for older adults and in particularly infants. It's whooping cough, right? And otherwise healthy adults, that is a pain, but we can get over it. Children and older adults with underlying cardiopulmonary issues cannot. And so this is a real important one to get, and you only need to get it once. So if you've had a Tdap once, you're done. You do need to get a tetanus every 10 years just to update it, and if you step on a rusty nail, it needs to be 5 years. But otherwise, the tetanus or the diphtheria pertussis is only one time in your life. So pretty easy, and if you have any grandkids or are pending any grandkids, you ought to get this one. Make sure you're up to date on that.
Dr. Bush?
Yeah.
Back on the shingles vaccine,
Yep.
I got a question. I got vaccinated for shingles maybe 15 years ago.
Yep.
So which vaccine?
That was the Zostavax.
That's the first one.
You need the new version, yep.
So then about 6 months ago, I got shingles, a mild case. Had it for a month and it went away.
Yeah.
Do I need to get vaccinated again?
Unless you want shingles again. If that was mild and you tolerated it fine. The thing is that's a great question, because that shingles episode did not give you any immunity. That was just an episode of the virus that's already there, coming out, causing inflammation. Your body was able to shut it down. It is now circulating in your nervous system, hiding from your immune system, active. And when you get sick or stressed, it will come out again. If you get the Shingrix vaccine, it may not, or that next episode will be much, much less severe. So the recommendation would be yes, that you get the Shingrix vaccine.
And it's a two-shot.
It's a two-shot deal. Yep.
Is it once a year, shingles vaccine? Or
No, it's a one-time.
Oh,
You get the series of 2, and you're done for life. The Zostavax was the same way, but that one has been shown to, especially over 15 years, generally they're saying 10 years, you lose the effectiveness. This one, we're seeing durable immunity. So they were both said to be the one-and-done deal, but the Zostavax we did see attenuate, whereas the Shingrix does not. But that's a great question, because that is one example of that inflammation or that episode of inflammation is just that. You are already infected. That is an inflammatory reaction to an already existing infection. Any more questions on that? Yeah.
You had up there Tdap?
Tetanus, diphtheria, acellular pertussis. So the acellular, again, is just a reference to the pertussis virus put in a blender, and those proteins are then injected.
That's a vaccination that's recommended for older people.
If you have not had it. You have likely had a Tdap vaccination in your life.
So you don't have to get it again?
No, you should get a tetanus every 10 years, but you don't have to get the Tdap. Yeah, good question, good question. Yeah, most of us don't have to worry about that. I put it up there because you need to know about it, but most of you are already vaccinated against tetanus and diphtheria. Yeah.
Do we need to get the pneumonia shot at our age?
Yeah, great. That's going to come up. Did I already talk about that?
Yeah.
Yeah. You need to get the pneumonia vaccine. Absolutely. And you possibly have had one of them, and there is another one that you likely need to get if you have not had two. That is not a series of two. That is just a newer version that is covering more strains. All right, and that will likely continue to happen. But you should be up to date on your pneumonia vaccine. Absolutely. Good question. You had a question?
Before our grandson was born, we got the Tdap because we were told
Yep.
we should because of the baby. Would we have had that when we were younger?
Likely.
Even though we're in our 70s, so they might not have been.
Yeah, that's a good question. I'd have to look up when we started that. Yeah, that's a great question.
Yeah, we got it before our grandson was born to be safe. But
Yeah, if somebody wants to Google that when the Tdap started, that's a great question. So maybe we need to discuss that further, because that is exactly why you would get that, to protect your grandchildren. Yep. Okay, good questions. Okay, that we went over. Yep. All right. COVID-19. We currently are issuing the Novavax, and that is an adjuvant spike protein. So that is not an mRNA vaccine. We are not administering the mRNA vaccine here. It's much like many of the other vaccinations that you get. It stimulates the cells to recognize that spike protein on the COVID-19 virus and then attenuate the effects. The thing with COVID-19, though, is it mutates very, very, very quickly. And so these will change every year. They're likely going to start combining COVID and flu because of the similar rate of change. But nonetheless, and it is indeed still recommended for people over the age of 65 and those with high-risk conditions that could get you in the hospital. For those that are middle-aged, otherwise healthy, there's some discussion there about whether that's, and in otherwise healthy children, it tends to be just a cold-like virus. But as we know, if you have underlying heart conditions and pulmonary conditions, a cold can be a pretty big deal. Whereas if you're an otherwise healthy individual, it's no big deal. So that's where that sort of decision-making comes in about whether you want to do it or not.
Where does this long COVID fit into that? That you hear about?
Yeah, so kind of ill-defined. We don't know exactly the mechanism of it. They do say that vaccination does help prevent that. The people who have long COVID, if you look at that cohort, the majority, I don't know if I want to say the majority, but a large percentage of them have not been vaccinated. And so and then comparing that to the population that has been vaccinated, they say that there is less long COVID in the vaccinated population. That is very poorly understood about what that inflammatory mechanism is and what puts a person at risk of getting that. Because it's really variable, and we haven't been able to kind of tease out the specifics of that. But vaccination seems to limit the risk of developing long COVID.
So if you've had, for example, I've had all the COVID shots, but a couple of years ago, maybe 3, my wife got really ill after having a COVID shot. She has not had one since then because of that. So would that mean that if she took another COVID shot, she would probably get ill again, like she did?
Yeah. I don't have the answer to that. I don't know. Because, I mean, sometimes they say you're not supposed to get all that ill with flu. But many people will say after they got the flu vaccine, I felt like hell for 2 days. Is that because of the vaccine? Is it because we're giving the vaccine in a season where flu and colds and viruses are proliferating anyway? School is starting. Everything's kind of out there. It's hard to tease that out. So what we do know is that some vaccines cause a more robust response, and the COVID vaccines have been, many of us have gotten different types of vaccines. Some of us got the mRNA vaccines, some the protein vaccines, some of us gone through the series of one company's vaccines, and some of us had every one of the different companies' vaccines. So it's really hard to tease out how to figure that out or predict how you're going to respond to it. So I don't know. But if you get ill, it's certainly, I got brachial neuritis from a flu vaccine 2 years ago. And I skipped the flu vaccine for the last 2 years because I couldn't use my right arm for about 3 months. Was that because of the flu vaccine? I don't know. The timing seemed to fit, but it really kind of pulled me back from, I don't want to do this again. But then I'm getting this talk. I'm hearing about H5N5. I'm like, okay, I'll get the vaccine. So I got the vaccine. So we'll see what happens. If I get brachial neuritis, I'll follow up. Okay. Where were we here? Side effects, the real data, boost. Okay. RSV, another one that's real important. This is a one and done again. The one that we're not doing it, but Bemis is. It is also much like the COVID vaccine that we have here, a recombinant protein vaccine. So again, it's just a protein from the shell of the virus that is causing the body to recognize it. That RSV is a big deal, again, for very young kids and for older people with cardiac and pulmonary issues. And so that is a pretty easy slam dunk to say, yeah, get that vaccine because that will keep you out of the hospital.
Question.
Mm-hmm.
So if we don't have cardio or pulmonary issues, we don't need to get that one?
Yeah, good question. I think that that's when you have to start talking about risks and benefits. Getting the RSV vaccine is pretty low risk. There's minimal side effects. I don't have any reports of adverse effects from people getting it. And so I think the threshold or the price to pay is pretty low. And if you get hospitalized, even if you don't have underlying issues, you can get an infection enough to be hospitalized. And at our age, a hospitalization alone is detrimental. And so I think that you are certainly at lower risk having no cardiopulmonary abnormalities, but you are not at no risk. And you help prevent from spreading it to the people around you who may be immunocompromised. And that was the argument for the COVID-19 vaccine. So the recommendation, the short answer is I would recommend it regardless. I would not recommend it as strongly or be as vigorous about imploring you to get it if you didn't have cardiopulmonary abnormalities. But I would still suggest you consider it strongly.
That's a one-time shot.
Yes. Yep. Good questions.
Is there a flyer somewhere? Put all that's on there. It's like vaccines for 65 and up.
Yeah, I can do that. Yep.
Well, it's just easier.
Yeah, that's easy enough to print out for sure.
I'll tell you what, we'll get it, give us a couple days. We'll get this
Okay,
video as well as the slides, and then we'll get that document as well on Dr. Bush's page on our website,
Okay.
and you'll be able to download it from there.
Okay, great.
Okay, what's normal, rare, and concerning? You're going to have very likely some side effects to any vaccination that you get. That is somewhat reassuring in that your body is responding. There's something happening. You're developing an immune response. Vaccines that we give are monitored very closely by the FDA. The Vaccine Adverse Event Reporting System, as we discussed earlier, the Vaccine Adverse Reporting System is an independent organization. The FDA obviously is not. So whether you want to believe the FDA or not, that's up to you. I do believe that these vaccines are heavily monitored, studied extensively, certainly more than any of the nutraceuticals or supplements that many people are taking that have absolutely zero regulation, and many of which are contaminated with heavy metals. So nonetheless, vaccines are monitored, and they are, in the whole grand scheme of things, very safe. Severe side effects are rare. Anaphylaxis, allergic reaction to one of the components of the vaccine is really where you see most of the major adverse events, particularly people who are allergic to eggs, although we have a cell culture now for the flu vaccines where we don't use eggs, so that is becoming less and less. But that used to be the major issue, was people who were allergic to eggs, they were getting the vaccines and having anaphylaxis. And then obviously, if symptoms are persistent and worsening, you need to be reassessed, but that's generally not the case. Okay, let's look at some more myths. We still got time here? Okay. Vaccines were rushed. Historically, that has not been the case. These vaccines have been studied extensively. They've gone through many stages of trials. In the case of the COVID vaccines, mRNA vaccines have been around a very, very long time. They didn't just appear during COVID. They were certainly accelerated with a great deal of funding to get these things out. And I think in that setting, yeah, they were rushed, and we saw some adverse events, we saw some misinformation, and that unfortunately has led to a lot of skepticism among the public for government organizations. So, but COVID, I mean, that was an extenuating circumstance. I hate to have people extrapolate that to these vaccines that have been around for decades, have been established to be safe, and are keeping people healthy and out of the hospital. I think that that is certainly something that you always want to be cognizant of. And if somebody, Rudolf Virchow, the father of modern medicine back in the 1800s, said, use these new medicines while they're still safe. It's kind of like a tongue-in-cheek, use these new medicines while they're still safe. New medicines, if you're taking a brand new medicine, one that's advertised on the television, for example, any of these injectable diabetes or weight loss medications, you are still in a human trial. Those have gone through groups of people who were highly selected to get approval by the FDA. And then we've all heard of medicines, Vioxx, et cetera, that get on the market. Then people start dropping dead or developing a third eye, and then we have to pull them off. And so that there is some real, there's some truth to these new things being experimental until enough of the population gets it, and we can really have a population-based study. None of these vaccines, and now I would not even classify COVID as one of those vaccines, is in that category. These have been extensively studied. So I don't think these are new medicines. I think these are well-established medicines or treatments. I don't trust the government. Moving on. No, I think this is tough. This is a great example just between these last two administrations and the vastly different sort of approaches to healthcare, particularly healthcare. I think that trust but verify, right? Ronald Reagan, trust but verify. Make your own personal decisions, try to gather as much information as possible, speak to the experts that you know, and make an informed decision together. I think that's what we can do. The government is for the vast majority of people. You are a person. You need to make that decision given the overlying information, and that's what we're here for. So whether you want to trust the government or not, that's not my issue. I want you to trust me, and that's where the rubber meets the road. Natural immunity is better. We discussed this. In some settings, yes. In the case of chickenpox, not really, because you're developing that later onset shingles issue. But there is definitely robust response. If you are able to survive that infection, you have good immunity. But were you willing to pay the price, or were you able to pay the price of that natural immunity? That's something that you'll have to consider. I'm too old and it won't help now. I don't think that's the case. That's all relative. Okay, practical next steps. Talk to me or your primary care provider. Bring someone with you to help advocate for you. Know your vaccines and your records, what you have, what's been given, what you need. And certainly bring a list of concerns. I'm always happy to address the list and advocate for yourself. I can't stress that enough. Advocate for yourself. And that goes for in the office and after you leave the office. If you were told something, that you were going to get something or somebody was going to call you for something, advocate for yourself. If you're not hearing anything, call. Call us. Get the information you need. We are here to answer your questions. We don't have great systems to remind us to stay on top of everything. Things do fall through the cracks. Advocate for yourself. That's the main point. Okay, conclusion. Vaccines offer protection, not pressure. Knowledge empowers decisions. Again, just make an informed decision. Talk to the people you trust. These will overall, I think, help you live longer. And I think that is the whole point. To keep you out of the hospital, to keep you out of my office, other than for medication refills. And I'll only hold you hostage to that once a year.